WHO, the World Health Organization, came out recently and said that cannabis is the safest drug, the safest substance on the face of the earth. And then they followed that with psilocybin from magic mushrooms being the safest recreational drug on the face of the earth. Now, World Health Organization, who knows where they may be getting their information from. But I mean, at the same time, the FDA approves drugs that we use daily that kill thousands.
Right. We know from everything I know is like, I've never heard of a marijuana overdose, right? Or cannabis overdose, or the mushrooms. I've never heard of overdosing on that.
There's zero death tolls to cannabis.
Right. And this is now, for the audience here. I just want to mention, we're not saying, especially with the COVID situation, we're not saying, please go and start smoking cannabis because it has antiviral properties. Let's just hold off on that.
No.
This is very interesting information. So those are some of the misconceptions, is basically that, to summarize, that it's a gateway drug and that users will try other drugs and maybe become addicted and basically have a problem with addiction and other substances.
Yeah. If you want, let me see if I can maybe share this. What I can do, Amelia, is I will email you.
And we can post it, or...
Yeah, I'll email you. I have a 113 slide CEU that I gave to Dr. Goldberg, and I presented it to the Emerald Coast Mental Health Association. And it is all encompassing from disease processes to misconceptions to, as well as all research references. It's not just stuff.
Okay. All right, that's great. Yeah, thank you. Okay, and so you already mentioned, because I'm a psychiatric provider, so with regards to mental health and cannabis use, specifically in psychiatry, what have you seen so far in your patients? So you already mentioned about yourself, your PTSD and your Crohn's disease, but the PTSD piece, it seems to have helped your symptoms. What do you see? What are the major types of conditions you see, and who has the best results with medical cannabis in the mental health population?
So usually the vast majority of mental health population diagnoses that I see range from PTSD and anxiety, usually topping, they're at the top of the food chain. I do see a lot of depression, a lot of insomnia, minor bits of ADHD, minor bits of bipolar, even fewer of... I do have a few patients that suffer from dissociative identity disorder.
Okay.
And they all see results. They've all titrated down off of their prescription drugs, and none of them see adverse reactions as long as they steer clear of high amounts of THC products during the day. So, for instance, like my anxiety patients, I steer them, and while, once again, this is a recommendation from physicians and from myself, we can't prescribe them straight CBD and just allow them to just take that. So a lot of it is me trying to educate them that, yes, while you may want to smoke and get quote unquote high, that's probably not best for you.
Right.
So patients that suffer from anxiety specifically usually follow a higher CBD regimen throughout the day so that they don't experience any of the euphoria or the psychosis effect of the cannabis.
Okay. Of the THC, you mean, right? The THC.
Yes.
Because
THC
CBD is non-psychoactive, supposedly, right? And some of the compounds are psychoactive. Those are the ones that, quote unquote, would get you high. Okay.
Right.
What about, and this is, you didn't mention schizophrenia, which I'm not surprised you didn't mention that, but have you seen any schizophrenia patients on medical?
So I have two that come to mind immediately, and they are they are very, very complex cases. Usually they end up with polypharmacy approach. But at the same time, when they do use cannabis, specifically CBD enriched products, and even by CBD enriched, I'm not talking about from like the gas station or even GNC or any of these, anything you can get without a Florida medical cannabis card.
Outside of a dispensary, basically.
Correct, yes. The products that are sold in the dispensaries that are CBD oriented, those seem to help them. They may not get completely off of their medication, but a lot of them see titrations down. But they do still ride the roller coaster of one of my patients specifically. I kind of had to monitor his access to high THC products because he would use his CBD products, and then this particular patient didn't drink alcohol, but when he wanted to relax, he would want to get a little over medicated, and then that would spin him out of control. And and this is another little known fact, is you overdose on a lot of illicit substances, we as nurses, we pump you full of Narcan. Violent withdrawal. You drink too much alcohol, you get your stomach pumped, and or you got to wait it out. There's no quick fix.
Right.
With cannabis, if you get too quote unquote high, you can literally take CBD products and it will actively on the spot reverse the symptoms.
Counteract the psychoactive effect.
Yeah, immediately. There's no lag. You can immediately dial back your high by using heavier CBD products because it's a more powerful molecule and sits in the CB1 and CB2 receptors more efficiently than THC does.
Okay. Excellent.
But yeah, I mean,
it sounds like it would be a very fine line for these patients with schizophrenia.
Yes.
And that's the only reason I asked is because of the psychosis component. But okay. So are there benefits experienced differently by people of different genders or age groups or racial or ethnic backgrounds?
So this is where it gets very, very tricky, and where there, as of yet, we're getting there, but there's no exact science to cannabis therapy, because every single person's endocannabinoid system is structured differently. Even patients of mine that have Crohn's disease, and they hear that I have Crohn's, and they think, yes, I found, the silver bullet. I'm just going to follow what Frank says, and I'll get off all my medications just like he did. That's not the case, unfortunately. Mm-hmm. So cannabis, everyone who has anxiety, 75% of those patients, Xanax may work for them, and that'll be good. But every single person's endocannabinoid system being individualistic, it's always a self-experimentation. While we do have a rough structure, like I had mentioned, psychosis, psychiatric problems, CBD, chemotherapy, appetite, pain, sleep, THC.
Okay.
And then from there, each patient, basically, I assist in guiding them through products, through their own personal experience, as well as I recommend journaling to help guide them down the right path.
So it's a very kind of individual treatment plan. Do you think that if let's say the government, if the substance was no longer category 1 on the DEA list, and if research was allowed and was actually done, do you think that there could be a development of products or drugs derived from cannabis that would be more targeted to each specific?
So there are a handful of synthetic cannabis products that have already been released and have already been used by the public, myself as well. Marinol is one of them, and it only works for a short period of time and then it stops. Okay. Epidiolex is another one that they were using for patients with multiple sclerosis in the trial, okay. As well as Parkinson's disease. It worked for 6 months and then stopped. whereas natural cannabis, like just nothing lab made, something grown out of the earth, continued to work into the foreseeable future for these patients.
So there's no poop out effect, like we call in psychiatry.
Yeah, it's kind of tricky. It's almost, if I would hope that once cannabis drops off of being a Schedule I drug, if we're going to use it as medicine, that it's continued to be, I guess, monitored like it is currently in medicinal states, and that it just becomes a prescription versus a recommendation, and not let big pharmacy, because if you can grow something in the backyard that cures or helps you with your anxiety, your depression, your PTSD, all of these, we're eliminating a lot of big money out of big pharmacy's pocket.
Right.
Okay. So I think it's a multifaceted issue. I mean, even blatantly in the fact that there's over 30, I think we're at either 32 or 34 states that have medical cannabis, yet it still sits as a Schedule I drug, which by definition has no medical benefit.
It makes no sense.
So, yeah, I think it's a multifaceted issue with it becoming, dropping off of a Schedule I, as well as how it'll be handled once it isn't.
Right. Okay. That's going to be a complicated process, but I would like to see that. I would like for it to not be a Schedule I drug anymore. So, silly question, may sound a little silly. Smoking specifically, using it that way, through that route, smoking cannabis versus tobacco. Which one's more harmful?
So this is what I tell a lot of patients, because I'm asked this a lot. And obviously taking in anything that's non-atmospheric into our lungs is a bad idea. It's an irritant. Now, the difference between a cigarette and smoking cannabis is a cigarette has formaldehyde, fiberglass, carcinogens, tar, who knows what else is put in it. When I grind up a bud of cannabis to smoke, that's all that's there. There's no tar. There's no carcinogens. Cannabis has anti-carcinogenic effects.
What about the smoke part of it, though?
So while an irritant, it's one of those kind of, there's a catch-22. So if you're having a panic attack, right, and you need alleviation of your symptoms now, you can take a few puffs and your symptoms will be alleviated, while you can follow up with another route that may be less harmful on your lungs, such as eating a lozenge or something of that nature, to where the CBD in this instance is digested, but that takes a half an hour to 45 minutes. So it's one of those benefits outweigh the risks.
Okay.
But then at the same time, I have many patients that have metastasizing lung cancer, and they smoke their cannabis and it directly helps them. I've taken COPD patients off of their oxygen by inhalation cannabis, because cannabis THC is a vasodilator.
Right.
So we're opening up the alveoli. So it's a lot of, would I recommend that you puffing on your pipe all day long? No, if you puff on anything all day long, that's going to be bad.
Right. Okay.
But, there's a lot of monitoring, a lot of, what's the, you want that Goldilocks, that just right kind of.
Just the right spot. Okay. What about the inhaling